Hello everyone, welcome to Sharmit. In this session, we are going to discuss about few more medical terminology in order to understand the suffixes of medical term. Okay. Prior to this session also, we discussed various terminology where we discuss different kind of suffixes. So this session is in the continuation of the same, where we will talk about few more suffixes that are used with medical terminology to provide some extra information. Okay, so we will proceed in the same way. Firstly, I'll walk you through a couple of the suffixes. We will understand their meaning, and then later on I'll show you some examples which will help you to understand the concept in a way that later, if you are preparing for any interviews or maybe for any exam, at that time it would help you to identify other terminology meaning. Okay. Fine. So I think now we are good to start with the session, but just before we proceed further, I would like to recommend you to please go and check out the previously released sessions first, because they all are in proper sequence and sync. So if you follow them sequentially, then it would be much more easier for you to understand the ongoing topic. Okay. For time being, we are just mainly focusing on how to use suffixes. So let me go to next slide. So fine. So we are going to discuss some common suffixes. And here the first suffix that we are going to learn today is the IUM. So whenever you see this suffix in the end of any medical terminology, like here, here and here, that means we are talking about something related to structure or tissue. Okay, either structure or tissue. For example, endocardium, which is inner lining of the heart. So again, we are talking about the structure of the heart, inner lining, outer lining, right? So for this thing, we are using the terminology endocardium, where em is used as a suffix. Similarly, if we are saying myocardium, that means muscular tissue of the heart. So again, we are talking about the tissue, and that's why we are using the terminology myocardium. And the suffix that we are using here is em. In the similar way, we have ostium, which is an opening or orifice in a bone, which is less common anatomical term. So again, we are talking something related to structure. That's why we are using this suffix. Okay. So I hope this suffix is clear. So whenever there is a discussion regarding structure or tissue, we will use this suffix. But remember one thing, in medical terminology, for one purpose, there are multiple alternatives that we can use. So that means, like, there might be possibility there that same thing is represented with some other prefixes also, other suffixes also. Okay, so don't get confused, but that is sure that if you will find something related to IUM, so there should be some discussion regarding the structure or tissue. Clear? Fine. Now let's move to the next suffix, which is lysis or lytic. So both of these suffixes are mainly used to show something related to breakdown, destruction or dissolving. So if something is in a breakdown state, something is in a destruction state or dissolving state, then in that case we will utilize the suffix lysis or lytic. For example, the first example shows thrombolysis. Thrombolysis means breakdown of blood clots. So whenever there is a breakdown of blood clot, then in that case we will use the terminology thrombolysis. In the similar way, when we are talking about the dialysis, this is the process of filtering waste from the blood. So again, we are breaking it down, we are distracting the things, right? So we are talking about the dialysis. Okay. Similarly, if a person is facing some issues where the cells are destroying, so in that case we will utilize the medical terminology cytolytic. Cytolytic means causing destruction of cells. So as I mentioned earlier, if we are talking about the destruction, then again we will use the suffix lytic. So same thing we have mentioned here, causing destructions of cells. And in the last example, we have proteolytic. So from its name, it is clear. Proteo means protein. So pertaining to the breakdown of proteins. Okay. So whenever a person is suffering from a disease where proteins are breaking constantly, then in that case, we will define that condition with the terminology proteolytic, where we are using the suffix as lytic. Clear? Let's move to the next slide. Here we will talk about the malacia and megale. So what is malacia suffix? So whenever you want to show something as a softening state, okay, whenever we are discussing something as a softening state, then in that case we will utilize the suffix which is malacia. And here you can see osteomalacia, the first example, which means softening of the bones. So sometime what happens, like due to the deficiency of vitamin D, patient will suffer from a disease where it's where their bones become soft. Okay, so that state where softening of bone occur, we will use the terminology osteomalacia, where we are using the terminology suffix as malacia. Clear? In the similar way, we have myelomalacia, that means softening of the spinal cord. In above example, we were talking about the softening of the bones, and in this example, we are talking about the softening of the spinal cord. But what is the common thing between these two examples? The common thing is softening. We are talking about softening. So whenever we are talking about softening, we will use the terminology suffix as malacia, M-A-L-A-C-I-A. Okay, and that's how these two terminology constructed, osteomalacia and myelomalacia. Okay, now the next example is used, next suffix is used to represent something related to enlargement. Okay, the suffix is megale. So if you are talking about megale suffix, then it means that whenever we are discussing regarding the enlargement of anything, like cardiomegaly is for enlargement of heart. So if we are talking about that, if we are talking about the condition where heart is enlarged, then in that case we will use the medical terminology cardiomegaly, where cardio is from its name it is clear, cardio is representing the heart and megaly is enlargement, so enlargement of the heart. Similarly, we have hepatomegaly. Hepatomegaly means hepto is related to liver and megaly means enlargement, so we are using the terminology hepatomegaly, where megaly is the suffix that is used to denote the enlargement. Clear? Let's move to the next slide, and here we will talk about oid suffix. So whenever we are using oid suffix, there should be some sense of resembling. Okay, so whenever there is a discussion regarding resembling, then in that case we will use the suffix oid. For example, osteoid. Osteoid means resembling bone, bone-like material secreted by osteoblast. Okay, so whenever we are talking about the osteoblast, it means like from osteoblast there are some secretion of material that are used for resembling of bone, so we will use the terminology osteoid. In the same way, we have thyroid, which is a gland named for its shield-like shape, resembles a shield. So here what we are using terminology thyroid, which is which is using the suffix oid. Then we have oma, which is mainly used to denote tumor or mass. Okay, so like these are the terminology that you might have heard most commonly, which is lipoma and lymphoma, where lipoma is a benign tumor of fatty tissue. Okay, so if a patient is suffering from if patient is diagnosed with a benign tumor of fatty tissue, then in that case that condition is represented through the terminology lipoma, where we are utilizing the suffix oma in the end. Suffix is something that comes in the end, right? So lipoma is that terminology and oma is a suffix. In the similar way, when a cancer is developed of lymphatic tissue, so we will use the terminology lymphoma, where lymph is denoting lymphatic tissues and oma is denoting the cancer or tumor. Okay, so that's why we are using this terminology. Clear? So these are the all suffixes that we have learned today in this session, which is em, lysis, lytic, malacia, megale, oid and oma. Now what you are supposed to do, just do the practice of it, and I'll do one thing, like in the end of every session I'll put one question here which will help you to remember all previously discussed topics. Okay, otherwise, because there are so many suffixes, so many prefixes, so if you try to learn everything you might get confused. So it's better to do practice and remind the topic on the regular basis. That's why today's question is, why do we use suffix emia? So this thing is already discussed. You just need to write the answer in a short form. Okay, and once you write the answer, it will help to other as well, because if let's say someone is not aware of this answer, so they can simply refer it from the comment section. And in the same way, it is also helping you for preparing for interviews and exams. Okay, so please do share your knowledge in the comment section, and in the next session we will discuss few more things. So thank you for watching Tech Sharmit.